Hi, it's Jane again, having come back from getting my cast off. Just come back. So I got back here and I wanted to report on the arthritis surgery. Remember again that I did have three actual surgeries done. I did 2 fingers and the thumb. And as my surgeon said, that's kind of unusual. I simply wanted to do it all in one time rather than in separate pieces. So it's taken a little longer. He said it's been a little more complicated and it probably hurts a little more than most people will go through who are having just one kind of surgery. So chances are, if you're not doing a whole mess of stuff like I am, it's going to be even more comfortable, or at least less uncomfortable, than what I experienced. On the other hand, this time when I went in, it was all good. I was worried about getting the pins off. I'd heard some bad things, and some people said it really isn't that bad. Some surgeries, they leave the pins inside and they don't have them extruding as they did in my hand. And my particular surgeon happened to use the style where he leaves a wire inside the finger and takes the pins out. And it was strange. As much as they hurt, I was sure it was going to hurt like crazy, and it did not. It was kind of strange, like someone was pulling very hard, but not painful at all. So I did a lot of worrying for nothing. I now have my hand back. It's a little stiff. My wrist is very weak. He put a little extra wrap on it just to give it a little strength, but that's not really necessary. Where the pins came out of my thumb here and on the 2 tips, we have Band-Aids on, and I'm not to get them wet or do anything, be careful with them just until they've completely healed over, because we don't want any water to get in there. Which means I have these incredibly scruffy hands. The texture, there are a few places that it's a little bit numbish still, but I think that's supposed to go away. It'll be less numb. Little place on my thumb over here and on the back of this finger over here. Other than that, feeling is there. The fingers hurt a lot more than the thumb, but again, this part of your hand has a lot fewer nerves than your fingers. They have lots and lots of nerves on them. So yeah, expect that they will hurt a lot. They were aching a lot, and the thing that I noticed whenever I bumped my fingers, they really ached a lot. But since he took the pins off, which was perhaps maybe an hour or 2 ago, they're really better. It's really better. I think the body was starting to reject the pins. That's Jane's medical theory. But whatever it is, it's actually an improvement. So this is really cool. The skin is incredibly disgusting. I actually rubbed it with a damp face cloth, and it rubs when it gets moist, that skin. You can see how, boy, I really do feel like a snake. It's really any place that was covered, any place that I haven't been able to use any water on it in almost 6 weeks. So what happens is the skin simply does not slough off, and it's really pretty ugly and dry. I have a lot of work that needs to be done. I have some exercises for my fingers. I will be going into physical therapy, bend them more and more, and get one of the exercises touching my thumb and fingers together. And this one, which I can't quite do, will roll down. Things to strengthen my wrist, get my fingers bending, get the strength back to them. But from here on, it looks like we're on the road to recovery. I have 2 hands again. I think it's going to get better and better. You can see in the Band-Aids a little bit of where, there's dried blood still in there, in between. And that will go away once I only have to wear the bandages for another 2 days. And then I can take showers and I can get my hands wet and all that. I noticed just with the damp cloth how much of this rubs right off. So I will have 2 functioning hands, probably nothing heavier than a coffee cup, for a total of 6 months. Be cautious about it. Obviously, it's been through a lot of stress, but we're on the road to recovery. It already feels better. All good. So I don't think I can think of anything right now. If you have questions and you want to ask me, I'll do my best to remember to answer them on this YouTube series. But this is the 5th one, and casts are off. Exercises are starting. The prognosis on my case is very good. Everything looks good on the x-rays, And chances are, most of the hand should be pretty back to normal by 6 months. And at a year, apparently I will know exactly whatever I have in a year is what I will have. So I hope this series has been helpful to you. If something comes up that I want to let you know, I will do another video. And if you are going in for basal thumb surgery or to have any of your fingertips fused for arthritis, it is a nuisance to lose your dominant hand. I'll have to tell you that, but I sure did get good with my left hand. You will get through it. Hurts a bit, but you will handle it. And hopefully I'm going to get a whole extension of many more years of good use on my hand. And I hope I've given you some good clues and some advice and something that'll help you feel a little more confident when you go in to surgery. Always ask questions. Know everybody reacts differently. And give yourself time and set up a good support network. You may not even need much of it. And look forward to 2 hands. And that's it.